recurrent miscarriage. Does pre-genetic implantation screening lower the rate of recurrent miscarriage? Why is it important? Recurrent miscarriage forms between 2 and 3% of those who are trying to get pregnant. It causes immense medical as well as psychological impact. Now, we do know that genetic screening of embryos will weed off embryos that have the highest chance of miscarriage or non-implantation. So in this study, which was a systemic meta-analysis of the existing studies, involved searching databases of studies of more than 2 unexplained pregnancy losses who underwent IVF treatment with or without genetic screening of embryos, that is PGTA, included 18 studies comprising of more than 11,000 embryo transfers. What were the key findings? The key findings were that genetic screening of embryos increased live birth rates to 85% per patient in multiple transfers. Miscarriage rates were reduced by 58%, and genetic normal embryos had the same success rates in recurrent pregnancy loss and non-recurrent pregnancy loss patients. What do we do know that in some cases it does help in lowering the chance of pregnancy loss, and also it's important to realize that studies are not yet complete. This is again one of the first phases where we are able to try and find out the cause of recurrent pregnancy loss and try and improve the chances of pregnancy. In my practice, what I do often advise is try and find out how many embryos are genetically normal, and then you can decide and see whether if you find a smaller proportion normal, it may give you a better chance of pregnancy.